Very nice for you to come in for your annual exam this year. Very nice to see you again. How are you doing? Good? Okay. Any new medical conditions since I last saw you? What about any surgeries? Okay. Do you smoke or drink? And then anyone new in the family diagnosed with a breast, ovarian, or uterine cancer? No. What about colon or cervical cancer? Okay. Now, since I last saw you about a year ago, any new intimate partners at all? No? Same relationship, male partner? Do you use condoms? Okay. And have you ever had any history of sexually transmitted infection or abnormal pap? No? Okay. Alright. Give me 1 second. I'm gonna kind of prep your note. You've had an annual before. You are due for your pap this year, so we'll be sure to add on the cervical cancer testing. And then if I see anything else during the exam, I will be sure to let you know. Just give me 1 sec. Okay. Do you have any questions before I step out and give you some privacy? No? Really nothing new, huh? Okay, so what I'm going to do is I am going to grab you a white drape. You will keep your t-shirt on, take off your bra underneath. You'll get undressed, waist down completely, and then I will come back in and we will get your whole exam going. Let me show you what we'll be using today, which I'm sure you already know. Alright. Pap specimen container. This is for the cervical cancer screening. You are already familiar with the pap brushes. We've got the Cytal brush. This will kind of go in around the opening, and the spatula, more on the outside. If you wanted any special STI testing for gonorrhea, chlamydia, trichomonas, you can always add on the swab. If you're having any normal discharge or any light bleeding from a period just finishing, we'll use these swabs to clean it up. And if you are feeling really, really tense, we have a sperm stress ball. Yes. All right, let me step out and then we'll get you going. Perfect. Looks like you're all situated. Okay, I'm gonna put some gloves on. And as always, we'll start the breast exam. Yep. Alright, so I'm just gonna lift your shirt. Alright, and you're gonna take your arms, rest them above. Perfect. Have you noticed any new lumps, changes, discharge of the nipple, swollen lymph? No? Okay. Alright. Do your breasts get swollen or tender before periods at all? No? Okay. On to the next one. Yep. Do you feel me poking there? Okay, what I want you to do, I want you to take your hand for me and feel where I'm pointing. You feel that little lump? No, don't freak out. There are plenty of benign, breast conditions where we can feel lumps and it be completely benign, so not cancerous necessarily. The good news is it's kind of more rubbery, it moves. So when I poke at it, it kind of moves around. Does it hurt you? Okay. I'm taking a look at the lymph nodes in the area. None of it is swollen. Alright, and there's no discharge coming out of the nipple. So what I'm going to do is I'm actually going to mark that area we see here. And I'm just going to measure it, okay? Just for documentation. So here's what we're going to do. I'm pretty sure that what we're seeing today is just a very benign fibroadenoma, really common in people in their late teens, early to mid-20s. But I am going to just write out an ultrasound script for you so that we can confirm it through imaging. Yes, yeah, give me a second. Alright. So this is of the left breast. We kind of look at the breast like a clock. So this is in the 2 to 3 o'clock position, about 2.5 centimeters in size. Mobile, rubbery, no nipple discharge, inversions, skin changes. Alright. So I'm gonna give this script to you on your way to checkout so we can get that taken care of. Alright, let's continue with the exam. The next part of the exam is I'm going to press on your belly here. A little bit sore there? Do me a favor, can you do a crunching motion for me? Like crunch up? Oh, okay. Do you do any weightlifting or anything like that? You had an incident where you lifted some heavy bar. Okay. I think honestly it looks like you may have a little bit of a hernia. Okay. Let me grab my notepad. So with that being said, we're going to order an ultrasound of the left groin area, kind of like the femoral area, and then I'm going to have you follow up with general surgery to get a second opinion to see if there's anything that can be done with that. Yep. I'm so glad you came in today. Yeah. A lot of times we kind of find things out for patients. They may not necessarily notice some of these things. Alright, so let's get situated now for the pelvic exam. Alright, let's go. Alright, looks like you're all situated. What's wrong? You're feeling really nervous. I know, I swear, it doesn't matter how many times you have these exams, you're just never very comfortable. You're feeling overwhelmed from the other. I totally understand. You know, this is the last part of the exam. If you want stress ball sperm, do you want it? Okay, sure, here. Just kind of squeeze on it. Now, you know I would never force you to do anything, so if you really do not want the speculum in, or you just feel super tense and you're extremely anxious or anything, just let me know and then we'll figure it out, okay? Okay, well, I'm going to turn on the light here. Okay. Alright. Of course, as always, we're just starting with the outside to make sure I don't see any lumps, bumps, any lesions. Yep. You'll feel my hands here. Okay. outside exam is good. Now, this next part is the pelvic exam with the speculum. Of course, I'll start with the smallest as I normally do. Here's the speculum. We're doing a kind of a smaller length as well as a thinner. Yes. Okay. I'm going to put some warm water. Okay. Are you ready for the pelvic? You let me know if you're too uncomfortable. I'm going to feel hands on the outside. Alright. Pressure. Now here's the part that feels weird where I expand it. Alright. Cervix looks very healthy. We're going to take the pap test now that screens for cervical cancer. Brush one. Okay. Brush two. The pap smear is done. Now let me ask you this. Have you noticed any vaginal odor by chance? Yeah. So it looks like you have a pH imbalance today, or what we call bacterial vaginosis. Now with anyone with new onset discharge that has never had that before, I usually recommend we test as well for yeast as well as trichomonas. Are you okay with that? Okay, well we're here anyway. Yep. Just going to collect a sample. Now some people after their PAPs, the cervix has a lot of blood vessels on it, so when I do the pap smear, sometimes it can irritate the cervix and cause a little bit of light bleeding. So if you get that, that's totally okay, alright? I'm going to use the swab to clean it. Okay. One more swab, just so you don't have to deal with it later. But yeah, regarding the bacterial vaginosis, one of the most common reasons I see people get it are people who even overclean the area. They stick water up there, soaps up there. You've been doing that. So what you want to do is avoid using anything in the vagina. No water, no soaps, none of that over-the-counter stuff that's supposed to help pH, because that just ends up throwing your pH off more. So let me take the speculum out now. Alright, last part of the exam is the exam with my fingers, if that's okay with you. And I just want to make sure I don't feel any masses or tenderness. Now, patients can opt out of this, but if you're someone who just wants the most thorough exam possible, we can do that. Perfect. Alright. Forgot the lubricant. Give me a second. Alright. Lubricant. Alright. You can turn the light off. Last part of the exam here. No masses. You weren't tender at all when I did that? Perfect. Excellent. Okay. Let me grab my script pad. you did fantastic on your exam today. Now, to conclude, we suspect a fibroadenoma in that left breast, so we ordered the ultrasound. We also saw possibly a hernia. Okay, so I'm referring you to a general surgeon for a second opinion, and we're going to get an ultrasound on that area as well. Yeah. And during the pelvic exam today, I saw BV, or what we call bacterial vaginosis, very common pH imbalance in the vagina. This is not sexually transmitted. I am going to prescribe you an antibiotic called Flagyl. You don't have any allergies. Good. Flagyl you're going to take twice a day for 7 days. Absolutely no alcohol with it. And that should clear up the pH imbalance for you. Yeah. I am going to send out all these orders electronically. The girls up front are going to give you the number to schedule it, and then you will be all set. I am going to call you once your results are back, and then me and you will come up with a game plan. Yes, absolutely. My pleasure. You can keep the sperm stress ball, and then we will be in touch. Absolutely. You are so welcome. I hope you have a good day, and we will address all of this eventually, okay? Yep. All right. I'll see you later.